Hello everyone, good afternoon. My name is Angelita Frisca. My student ID number is 130 86 228. So today I want to show you guys my video presentation about generalized anxiety disorder or GAD. But before that, I would like to thanks to our lectures in biochemistry, Sri Rahayu and biomed because I was given the opportunity to show my presentation. So let's get started. So now I will start my video presentation about generalized anxiety disorder or GAD. My purpose to choosing this topic is first the introduction about generalized anxiety disorder or GAD. Second, to inform the symptoms that someone is suffering from generalized anxiety disorder or GAD. The third, to inform the cause of generalized anxiety disorder or GAD, and the last, to inform the treatment of generalized anxiety disorder or GAD. Next, what is anxiety? Anxiety is feeling of unease such as worry or fear that can be mild or severe. Everyone has feeling of anxiety at some point in their life. For example, you may feel worried and anxious about citing an exam, or having a medical test, or job interview. During times like this, feeling anxious can be perfectly normal. But some people find it hard to control their worries. Their feeling of anxiety are more constant and can often affect their daily life. Anxiety is the main symptom of several conditions, including panic disorder, phobias, post-traumatic stress disorder or PTSD, social anxiety disorder or social phobia, and generalized anxiety disorder or GAD. And on this occasion, I will explain about generalized anxiety disorder or GAD. What is the difference between anxiety and generalized anxiety disorder or GAD? Usually, anxiety is normal that we are more alert and take care of ourselves. If the generalized anxiety disorder or GAD is more extreme, it can interfere with productivity. Next, what is generalized anxiety disorder or GAD? GAD is one of the common mental disorders. Generalized anxiety disorder is produced fear, worry, and a constant feeling of being overwhelmed. Generalized anxiety disorder is characterized by persistent, excessive, and unrealistic worry about everyday things. This worry could be multifocal, such as finance, family, health, and the future. It is excessive, difficult to control, and is often accompanied by many non-specific psychological and physical symptoms. Excessive worry is a central feature of generalized anxiety disorder. Factors commonly associated with generalized anxiety disorder include female gender, unmarried, poor health, low education, presence of stressors, and the median age of presentation is 30 years. Patients with anxiety can pose a diagnostic challenge as somatic symptoms or physical symptoms are more common than psychological symptoms. Psychological symptoms of GAD. GAD can cause a change in your behavior and the way you think and feel about things, resulting in symptoms such as restlessness, a sense of dread, feeling constantly on edge, difficulty concentrating, and irritability. Your symptoms may cause you to withdraw from social contact, seeing your family and friends, to avoid feelings of worry and dread. GAD can also have a number of somatic symptoms or physical symptoms including dizziness, tiredness, a noticeably strong, fast or irregular heartbeat or palpitation, muscle ache or tension, trembling or shaking, dry mouth, excessive sweating, shortness of breath, stomach ache, feeling sick, headache, pins and needles, and difficulty falling or staying asleep or insomnia. What causes GAD? Research has suggested that this may include overactivity in areas of the brain involved in emotion and behavior, an imbalance of the brain chemicals serotonin and noradrenaline, which are involved in control and regulation of mood. The genes you inherit from your parents, having a history of stressful or traumatic experience such as domestic violence, child abuse, or bullying. Having a painful long-term health condition such as arthritis, having a story of drug or alcohol misuse. But many people develop GAD for no apparent reason. How GAD is treatment? The two main treatments for GAD are cognitive behavioral therapy and medication. Patients may benefit most from a combination of two treatments. First, cognitive behavioral therapy. This includes physical education, changing maladaptive through patterns and gradual exposure to anxiety. Second, pharmacotherapy is treatment using several types of medication are used to treat GAD, such as antidepressant, antipsychotics, benzodiazepines, and buspirone. All medications should be titrated slowly and continue at least for weeks to determine if they work. When symptoms are under control, the medication need be used for at least 12 months before gradually tapering them. Every medication has adverse effect. Psychotherapy is used in addition to medication. This combination has proven to be effective. The education of the patient is vital as it can help anxiety. The triggers for anxiety should be managed like avoiding caffeine, alcohol, nicotine, stress, and improving sleep. Okay, that's all my presentation about generalized anxiety disorder or GAD. I hope you enjoy and understand. When you have any question, please ask to me in the season Q&A. Thank you for your attention. See ya!